Welcome back to The Big Picture here on the 10 TV app. It is 9:19, and right now we want to talk about caregiving and a lot of the stresses that come along with that.
And a lot of people, I feel like, have direct connections to this topic.
Right.
Like you were just mentioning, you said your mother took care of your grandmother, and I watched my mother take care of mine as well, and it's really taxing in a lot of ways, emotionally, financially, physically. The list goes on.
Right. And I mean, some new data released from AARP Ohio is that, 93% of caregivers are spending their own money to do this. And 47% of those people are feeling some strain financially. With that being said, right now we want to bring in Jenny Carlson. She is the director for AARP Ohio. Jenny, thank you so much for joining us on this Tuesday. When it comes to Ohio caregivers being stretched really to their, both emotional and financial limits, what else is this new data from AARP revealing about some of the work they're doing?
Well, we have a growing aging population, and more family members are stepping into that caregiving role. And that's really important to note. I mean, that is individual caregivers like myself providing care to parents, spouses, community members. And then there's a significant emotional impact for those caregivers. The caregivers are really supporting a broken healthcare system. And that emotional toll is the cost of not pursuing their own healthcare, rationing their own healthcare, seeing their financial resources, their savings go down the drain, not being able to pay their bills. And it's challenging for caregivers right now. It's overwhelming.
And when you say emotional toll, I know you have a personal connection to this. Can you speak about the strains that you experienced and felt when you were caregiving for your own mother?
So we moved my mother. She's 88 years old. She's now in great health. She wasn't in perfect health during the pandemic. We ended up moving our family home. We merged together. It's an intergenerational home, and it was stressful. I mean, it was a significant event that led to us needing to move her in with our family. You don't plan your life thinking that you're going to be a caregiver. There are resources out there through AARP. We've got resources that individuals can turn to understand what it means to enter into that caregiving journey. But usually that's unplanned. And so it's challenging to step into that role. I didn't grow up thinking I was going to split my mother's medicines or have to be the nutritionist explaining to her, what a healthy meal is like. And then taking time off of work, working full time, and being able to take her to her wellness checks.
And, we talk about that, you were in that experience. My mother's been in that experience. A lot of people have these experiences of taking care of a family member, whether that be a parent or a grandparent or even a child. What are some of the gaps that are out there in terms of state support that make caregiving harder on somebody who is trying to just be there, to be that person, to care for someone?
Well, the gaps are significant. We have the emotional support needs. When caregivers are providing support, the majority of caregivers are working full-time, and so they're working before they go to work, after hours, spending time with their loved ones on the weekends. And so providing direct care and not getting the needed respite, care that is needed to provided for that individual caregiver. And then you also have those financial strains. I mean, significant pressures being able to make, like hard choices around workforce. Do you remain in your job, or do you take something lesser to be able to spend more time with a family loved one? And then you also have those hard caregiving decisions that you make. What are you doing personally to make sure that you're remaining healthy? And then can you take time off at your job to be able to take your loved one to those needed appointments? And so there's significant pressures. And so we are working with policymakers to raise awareness around the pressures caregivers are facing. I mean, working caregivers alone are providing over $1 trillion worth of unpaid care a year. And that's significantly helping our workforce, our healthcare workforce that is in desperate need of support. So there are significant ways we're working with elected officials on raising awareness and advancing public policy.
You talked about the $1 trillion, the financial strain, the emotional strain that can sometimes come along with caretaking like that. What resources are currently available in Ohio that maybe some caregivers may not know about?
So I would highly suggest that you check out AARP resources that you can access at your fingertips. You can call a live toll-free operator to understand a little bit more about your care journey pathway, where you need help. It's available 24/7. We have resources out in the communities to be able to train up individuals. So as you start to enter that caregiving journey, what it means to be a caregiver, we have simple tools in place like caregiver checklists. When you take a loved one to your health care provider, you become a health coach. And so what does that mean? We're also working with elected officials on significant public policy initiatives like the tax credit. It's a non-refundable tax credit. We're going to be at the State House tomorrow testifying on that piece of legislation. It's important because caregiving is a pocketbook issue. Individuals are typically spending at least $7,200 out-of-pocket expenses to provide care for their loved ones. And that's a significant amount of money, especially when providing care is generally speaking unplanned. And so you're not budgeting that $7,200 per year where you thought that you were going to be able to do other things personally, but now you're focused more on your journey of being a healthcare provider.
All right, Jenny Carlson, the executive director of AARP Ohio. Thank you so much for joining us. It is that kind of caregiving is, as she mentioned, typically an unexpected challenge that a lot of people take on. And, there are resources out there, but there are gaps.
And we do know our population is aging fast here in Ohio. So it's really important that there are some resources available right now. They are obviously continuing to do work at the State House, as she just mentioned. But check out their website.
Right. So